Hey everybody, welcome back to Ask Dr. Dan. This week we're going to be talking about Tenjet. Tenjet is a device that's used for chronic tendinopathy. Your tendons are what attaches your muscle to your bone. Our tendons do not have a great blood supply like our muscles do. They're more fibrous. So when these areas get injured, usually by overuse, but sometimes by injuries, they tend not to heal quite as well as other areas of the body. So sometimes we have to do things to make it heal. The initial treatment for tendon pain is physical therapy, anti-inflammatory medication. If that's not working, then sometimes you'll try a steroid injection, or even things like PRP or stem cells can work. If all else fails, the other treatment used to be surgery. And for something like tennis elbow, what they would do is they would make an incision that was a couple of inches long, go down to the tendon and pick out all that bad tendon tissue. Now, with advancements in ultrasound and new technologies, we have devices like the Tenjet. So using ultrasound, what we do is we find the tendon, we make a really small incision, about 3 to 5 millimeters, and then we insert this needle to the area of the bad tendon using the ultrasound guidance. What you can see is at the end of this needle, there's a little opening there, and what goes through there is actually, it uses a high pressured water, and what that water does is it breaks up the bad tendon tissue and actually sucks it out. These two areas are connected to a machine that helps in that. The really neat thing about it is it's designed that the pressure of the water will remove only bad tendon tissue, which is weaker, and not the strong, healthy tendon. So it's a really neat device. It's done under local anesthesia. It's done right in the office, and very quick recovery. So we'll be taking your questions about this procedure over the course of the week, and we will be giving you answers on Friday. So have a great week, and remember, don't operate, regenerate.